Am I the only one that didn't know FDA timelines could actually be simple? If you've ever felt overwhelmed by the maze of regulatory deadlines, you're definitely not alone. The world of generic drug approvals is notorious for its complexity, and the FDA's timelines can seem like a moving target. But what if I told you that, with a little know-how, you can actually predict and manage these timelines with confidence? Today, we're diving deep into GDUFA 3 timelines, breaking down the FDA's goal dates in a way that's easy to understand, practical, and yes, even a little bit empowering. If you've ever juggled ANDA deadlines and felt lost, this is for you. Maybe you've spent late nights poring over guidance documents, or maybe you've had that sinking feeling when a deadline sneaks up on you. The truth is, the FDA's process for reviewing abbreviated new drug applications, ANDAs, can be straightforward if you know what to expect. So, let's take the confusion out of the equation and walk through the key milestones together. Let's break down GDUFA 3, no jargon, just clarity. GDUFA, or the Generic Drug User Fee Amendments, is now in its third iteration, and it's all about making the review process more predictable for industry and the FDA alike. The timelines we're talking about today are the FDA's goal dates, the targets they set for reviewing your application. These aren't just arbitrary numbers, they're the backbone of your regulatory strategy. Let's start strong. If you submit a complete ANDA under GDUFA 3 and there are no major issues with your application, the FDA's target is 10 months from the date of submission to reach a decision. That's right. 10 months is the standard review timeline for a well-prepared, complete application. This means that if you've done your homework, gathered all the necessary data, and double-checked your submission, you can expect a decision in less than a year. But, as with all things regulatory, there are some important caveats and opportunities to speed things up. But here's a game changer. Submit a pre-submission facility correspondence, or PFC, 60 days before your ANDA, and your timeline shrinks to 8 months. The PFC is essentially a heads-up to the FDA about the facilities you plan to use, giving them a chance to plan inspections in advance. By providing this information early, you're helping the FDA streamline their process, and in return, you get a faster review. This is a huge advantage for companies that are organized and proactive. Imagine shaving 2 whole months off your approval timeline just by planning ahead. That's 2 months saved, just by planning. It might not sound like much, but in the world of pharmaceuticals, 2 months can mean the difference between being first to market or playing catch-up. It can impact your bottom line, your competitive edge, and even patient access to affordable medicines. So if you're serious about efficiency, make the PFC a standard part of your submission process. Now, if your facility isn't inspection ready, brace yourself. Your goal date stretches to 15 months. This is where things can get tricky. The FDA needs to ensure that your manufacturing sites meet their rigorous standards, and if there are any concerns or if your facility isn't ready for inspection, the review clock slows down. Suddenly, what could have been a 10 or 8-month process turns into a 15-month wait. That's a significant delay, and it's often avoidable with proper preparation. And if you forget to update the FDA before month 15, that timeline can balloon to 30 months. Yes, you heard that right. 30 months. That's more than 2 years, all because of a missed update or a lack of communication. The FDA relies on timely information to schedule inspections and make decisions. If you don't keep them in the loop, your application can get stuck in limbo, costing you time, money, and market opportunities. So always keep them posted. Regular communication with the FDA isn't just a courtesy, it's a critical part of the process. Set reminders, assign a team member to track deadlines, and make sure every update is documented. A simple email or phone call can keep your application moving forward and prevent costly delays. Think of the FDA as your partner in this process. The more transparent and proactive you are, the smoother things will go. Amendments are the next hurdle. These are changes or updates you make to your application after submission. Amendments can be minor or major, and each type has its own impact on your timeline. Minor amendments might be small corrections or additional data, while major amendments could involve significant changes to your manufacturing process, formulation, or labeling. Understanding the difference is key to managing your review timeline. Minor ones add up to 90 days if late, which means that even small oversights can cost you 3 extra months. It's easy to underestimate the impact of minor amendments, but every day counts when you're racing to market. Make sure your initial submission is as complete and accurate as possible to minimize the need for amendments down the line. But major amendments can tack on 6, 8, or even 10 months depending on inspections. If your amendment triggers a new facility inspection or requires substantial additional review, the FDA's clock resets and your goal date moves further out. This is why it's so important to anticipate potential issues and address them early. The more thorough and proactive you are, the less likely you'll face major amendments that derail your timeline. Pro tip: fix labeling issues early with FDA's DRL process to stay on track. The Deficiency Response Letter, or DRL, is your opportunity to address labeling concerns before they become major roadblocks. By responding promptly and thoroughly, you can keep your application on the fast track and avoid unnecessary delays. Labeling might seem like a small detail, but it's often the difference between a smooth approval and a drawn-out review. Finally, if approval's just out of reach at your goal date, the imminent action window gives the FDA 60 more days to wrap it up, without counting as a delay. This is a built-in buffer that allows the FDA to finalize their review, address any last-minute questions, and issue a decision. It's not a loophole or an excuse for delay. It's a practical tool to ensure that applications don't get rejected over minor fixable issues. If you're close to the finish line, the imminent action window can be the difference between a quick approval and another round of questions. Master these and you'll never be blindsided by FDA timelines again. By understanding the key milestones, submission, PFC, facility readiness, amendments, and the imminent action window, you can take control of your regulatory journey. No more surprises, no more last-minute scrambles. Instead, you'll have a clear roadmap to approval and the confidence to navigate every twist and turn along the way. Subscribe for more regulatory clarity. See you next time. And remember, the more you know about the FDA's process, the better prepared you'll be to succeed. Whether you're new to generic drug development or a seasoned pro, staying informed is your best strategy. Thanks for watching, and don't forget to hit that subscribe button for more tips, insights, and simplified guides to the world of pharmaceutical regulations. Until next time, keep learning and keep moving forward.